So I'm here with my friend Rob Carroll from the Brody School of Medicine of the East Carolina University. And first of all, Rob, it's nice to see you.
Good to see you again, Lars.
I don't think we've ever seen each other in the United States.
No, we haven't. It's always been very interesting places.
And it's always fun when I get to sit here and congratulate a friend for winning an award. So congratulations on the Aspire Award and for the first one for your institution.
Thank you so much.
Why don't you tell us a little bit about the project that you won for?
Okay. The award we got was for social accountability, and that's really one of the hallmarks of the university. It's part of our hidden curriculum. The school was put in eastern North Carolina to try and take care of the health care needs of the eastern part of the state, which had previously been very poorly served. So the school was set up with a primary care focus. It was there to increase the access of underrepresented minorities to medical education and then to improve the health care needs of the state. So that has always been part of the structure from administration. Our Dean, Paul Cunningham, Senior Associate Dean, Libby Baxley, are strong advocates, buying completely to that, and that contributes to the success of the program.
So it sounds like it's a foundational component, and as such, aspiring to this was sort of a natural progression.
It was. The award gave us an opportunity to bring together different components because everybody's working on this type of activity in their own section of the school, but nobody's put it all together to try and see how the synergy actually is occurring between the different programs.
It's interesting. That's a theme that's come up a few times as I've spoken to other award winners this year and in the past, where it's sort of an external opportunity leads to internal reflection.
It does. For us in particular, the work that we've done on public health, tracking the improvement in the reducing healthcare disparities, improving the healthcare, and the dramatic changes that have happened in the eastern part of the state because of that. That information never made it into the medical education arena, and it really does need to be part of something we share with the students so they understand the importance of what we're doing.
And how early in the curriculum do you introduce this?
The introduction happens on the first day of the curriculum. Our first 2 weeks of the curriculum are focused on a clinical immersion component, where the students do a number of activities, including tracking patients going through the healthcare systems, as well as learning the fundamentals of clinical skills, so that as they acquire the information over the next 2 years in the preclinical phase, they have the context for why they're learning it, and they see how the information is going to be applied.
Would you advise other schools and universities to consider applying that model, and why?
Well, we've just implemented it this year for the first time, so I'm cautiously awaiting outcomes. It seems to have gone well, but we want to quantitatively evaluate it before. Now, in terms of getting these students involved immediately in practice, yes, by all means. Students did not come to medical school to sit in a classroom and to watch PowerPoint slides. They came to medical school in order to be physicians. So the sooner you can build that link for them, the more powerful the learning process is going to be for them.
And do they feel, and do you make them feel that social responsibility of the physician as a key component of their professional life?
Yes, and for that, we've actually been able to track that. Our admissions committee does a great job in selecting students who value trying to make the world a better place, and that we actually do evaluate more than just academics when we're admitting students. We want to look for students who have significant volunteer activities. 95% of the students who we admit have had significant volunteer time before coming into medical school. So it's a combination both of selecting students who are already inclined toward filling the social mission of the school, and then making sure we don't stamp that out of them within the curriculum process.
And are you excited about sharing this with the students?
Oh, very much so. The students are actually upset that they didn't get to come over to Barcelona to also receive it. I received a few emails indicating that they were available.
Yeah, I'm going to guess that you probably could have stopped that mid-sentence. The students were upset that they didn't get to come over to Barcelona.
That's true, very true.
But well, like I said, I always like saying congratulations to a friend. Anything else you'd like to share about what this award means, or what others should think about when considering applying?
Well, I'm grateful that the program exists, because it's so hard to try and show achievements in areas of medical education in some recognizable quantitative fashion. So the fact that the program exists to provide validation or to provide the recognition for what we do really is useful.
And I'm here with Stephen Charles also, who is an assistant dean at the school and a relatively new member of the faculty at the school. What does this mean to you in sort of validating the selection of this as your next career move?
Well, for me, it means that I've chosen a great place to come and work, a great team to be a part of. We have dedicated faculty, staff, and students who really take the mission of the school serious. And this award actually really kind of solidifies everybody together. So it kind of recognizes all of the achievements everybody's doing.
As you think about it and you go back and you have your duties and responsibilities, does this give you a platform for discussion and encouragement for other faculty?
Oh, absolutely. And I think it will only serve to increase the programs that we offer. And I think it will motivate a lot of faculty members and students to go out and be more service-oriented and really start thinking about how the mission of the school can be implemented and assessed.
I think it might be great to, when you share it with the students and say, look, this validates that you're in a school that really cares.
Mm-hmm. Absolutely.
What would you say to other folks who may be considering applying for this, or encouraging other folks to apply for an award like this?
I think to start early and to really focus on your school and what you've done successfully. And the application process is very specific and clear about what they're looking for. And you know, take it seriously, and then ultimately, whenever you do win, you have something to recognize for all of the hard work your faculty and staff has done.
I think sometimes people are hesitant to brag about themselves, but this is the kind of thing where you really need to say, we're good at this, we do this, we're special.
Absolutely.